both for those words. You know, you and I knew one another when I wasn't president, you weren't a chairman.
Right.
We'd ride back and forth on Amtrak. He lived in Philadelphia. I was commuting to Wilmington. It's good to see you both here. And thank both of you for your kind words. I want to thank scientists and researchers at Johnson & Johnson for the literal heroic effort that began when COVID-19 first spread and led to the safe and effective vaccine that are now being co-produced. Today, we're seeing two health companies, competitors, each with over 130 years of experience, coming together to help write a more hopeful chapter in our battle against COVID-19. I just had an opportunity to meet with both of these CEOs and with their senior operating officers and to hear about the work they're doing together to produce vaccine substitutes and accelerate what they call to take it to full finish. You know, what's clear is this is historic, nearly unprecedented collaboration. During World War II, one of the country's slogans was, "We are all in this together." We are all in this together. And the companies took that slogan to heart. For example, one automaker didn't have the capacity to build enough Jeeps, a competitor stepped in to help. Competing airline makers teamed up and they produced parts for each other and gave the American pilots, as a consequence of that, control of the skies. Today, we're seeing the same type of collaboration when it comes to getting this virus under control. I said we had to treat this like a war. So I want to thank the two companies for showing how we can come together and defeat this virus by putting patriotism and public health first. And I mean that literally, putting patriotism and public health first. Your companies have been working closely with a man you've both privately in the way over bragged about, Jeff Zients. Jeff is in the front row here. I want to thank you, Jeff, and the entire COVID team you put together for the coordination of our COVID-19 response, and Dr. David Kessler and his team at the Department of Health and Human Services. You know, when I came into office, we began working with the team of J&J to accelerate and add capacity to their manufacturing and production efforts. And it quickly became clear that Merck, one of the world's leading vaccine manufacturers, was in a position to be the partner we needed in this effort, in this wartime effort. I've not hesitated to use my power under the Defense Production Act to expedite critical materials in vaccine production, such as equipment, machinery, and supplies. And it's not just Johnson & Johnson and Merck. Pfizer, Moderna also work closely with us to help speed up the delivery of millions more doses. The result is that we're now on track to have enough vaccine supply for every American adult by the end of May, months earlier than anyone expected. And today, I'm directing Jeff and my HHS team to produce another 100 million doses and purchase another 100 million doses of the Johnson & Johnson vaccine. I'm doing this because in this wartime efforts, we need maximum flexibility. There's always a chance that we'll encounter unexpected challenges, or there'll be a new need for a vaccine effort, a vaccination effort. A lot can happen, a lot can change, and we need to be prepared. And of course, we need to match the miracle of science and the skill of manufacturing with the massive logistical undertaking of vaccinating over 300 million Americans. Already we have gone from Johnson & Johnson vaccine authorization to shots in the arm in 3 days. I was telling the gentleman, we were at a facility yesterday, a veterans outreach, and there were three members of the veterans community getting shots. One was getting of each of the three vaccines. And the guy in the middle, a veteran, was getting his, and I was standing about as far away as I am from you, and standing up, and he was sitting down, and as the nurse put it in his arm, he went, J&J, just one. Well, there's millions of people who are going to feel that way and be proud to be in a position that they're an ability to get the kind of help they need. 7 weeks ago, only 8% of the seniors, those most vulnerable to COVID-19, have received the vaccination. Today, 60% of the people over the age of 65 or older have received at least one shot. And that's because this is the population that represents 80% of the COVID-19 deaths. We've opened support and supported more than 500 community vaccination sites. That's more than, and they're administering hundreds of thousands of shots a day. And for folks who aren't near a pharmacy or mass vaccination center, we're deploying mobile clinics like vans that go into places to meet the folks where they live. We're also supplying vaccines to community health centers to reach those who have been hit the hardest and suffered the most, especially Black, Latino, Native American, and rural communities. And this is important because we know we have more to do to ensure everyone is treated with equity and those most impacted get the care they deserve. On Saturday, we hit a record of 2.9 million vaccinations in one day in America. And beyond the numbers are the stories. The father says he no longer fears for his daughter when she leaves to go to work at the hospital. The children are now able to hug their grandparents. The vaccines bring hope and healing in so many ways. Again, a vaccinated American is the only way to beat the pandemic, get our economy back on track, and for us to get back our lives and our loved ones. You know, that's why the American Rescue Plan was so critical. I want to thank Speaker Pelosi and the House of Representatives today for passing the bill, and I will be signing into law shortly. This bill represents a historic victory for the American people. I look forward to signing it later this week. Everything in the American Rescue Plan addresses a real need, including investments to fund our entire vaccination effort, more vaccines, more vaccinators, and more vaccination sites. Millions more Americans will get tested, including home testing. Schools will soon have the funding and resources to reopen safely, a national imperative. The American Rescue Plan, the partnership between Johnson & Johnson and Merck, proves we can do big things, important things in this country. You know, let me conclude with this. Tomorrow night, I'm going in prime time address the American people and talk about what we've been through as a nation this past year. But more importantly, I'm going to talk about what comes next. I'm going to launch the next phase of the COVID response and explain what we will do as a government and what we will ask of the American people. There is light at the end of this dark tunnel of the past year. But we cannot let our guard down now or assume that victory is inevitable. Together, we're going to get through this pandemic and usher in a healthier and more hopeful future. So there is real reason for hope, folks. There's real reason for hope, I promise you. So may God bless you all. May God protect our troops. And may God ease the pain in the heart of so many who've lost so many people in this pandemic. Thank you, and we're going to do this. We're going to get it done. Thank you.